Well, hi, everyone. This is Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. I am joined today with Tara Osseck, Regional Vice President of Recruitment, Jackson Physician Search, and Jenny Benner, Associate Vice President of Emergency Medicine Services at locumtenens.com. We are going to be talking today about some interesting upcoming information from locumtenens.com and Jackson Physician Search on onboarding. We've got both a webinar and a research paper coming out. That research paper, I want to get this right, JPS and Locum Tenens worked on this with AAPPR. I'm going to put that full description in our episode show notes, but now I want to welcome Tara and Jenny to the show. Welcome, y'all.
Hi, Daniel. Thanks for having us.
Yeah, it's great to have y'all here. Now, Tara, we've had you on the show before, but I think it always is helpful because we never know who's listening to this particular episode. I want to get a little bit of the healthcare background from both of you. So I'll start with Tara and then we'll go to Jenny from there.
Sure. Well, it's good to be back. Good to see you again, as always. And like you said, my role is Regional Vice President of Recruitment at Jackson Physician Search. For any listeners that are not familiar with JPS, we are a national leader in the permanent recruitment of physicians, physician executives, and advanced practice providers. And we're headquartered in Alpharetta, Georgia, but we have a very strong national footprint with regional offices across Dallas, Denver, and St. Louis, where I lead our Midwest division. I have been in the healthcare industry for almost 20 years now and spent nearly a decade working directly for health systems in-house, working in physician recruitment, physician relations, strategic planning, and business development before I joined JPS almost 9 years ago. I am proud now to lead a very talented team of recruiters that serve our clients in the Midwest and Upper Midwest. And I really enjoy the opportunity to provide strategic and consultative support and build long-term relationships with healthcare organizations and providers across the Midwest and across the country. And of course, partners like MGMA.
That's wonderful. Great having you back on the show, Tara. Jenny, welcome to the MGMA podcast. It's so good to have you here. Tell us a little bit about your background. What got you here today?
Absolutely. So nice to be here, Daniel. Thank you for having me. My name is Jenny Benner. I am the Associate Vice President of Emergency Medicine Services at locumtenens.com. Locumtenens.com is also located in Alpharetta, Georgia. We are one of the top leaders of locum staffing nationwide. I've been here for about 8 years. And before that, I worked at one of the larger health systems here in Atlanta and handled a lot of their practice onboarding or creating new practices. So onboarding's been a big part of my healthcare career from the beginning. At the hospital system here in Atlanta, my title was Physician Practice Integration Specialist. And what we did was, as the hospital was purchasing different outpatient practices, my team would go in and make sure that they coordinated with up to 20 different departments to make sure that they were properly onboarded, that they were JCO compliant, that they met all the criteria. And from that, I was able to see firsthand what a good onboarding and a not so good onboarding could do for retention overall.
Yeah, Jenny, I want to thank you for that because that really tees up what we're going to be talking about today. We're really talking about onboarding, and we're going to talk about it from a lot of different elements, sides of it, points of view, because we've got it both from the locum tenens side and the permanent side. And this is going to dovetail into an upcoming webinar that's coming up on July 16th through MGMA. I'm going to provide direct links to that in the episode show notes. I'm also going to provide a direct link to the research paper that's been put together for the sake of this. So, Jenny, I want to stay with you. Give us an idea of where you are. You're in that locums tenens placement side of healthcare. So just give us an idea of how you acclimated to that and maybe a little bit more background into that space.
Yeah, absolutely. So I was working with some of my physicians here in Atlanta, and they were talking about their previous locums experience. And that was really how I found locumtenens.com. they were talking about how great it was to have flexible scheduling where they have a better work-life balance. They liked that they could travel and experience different clinics throughout the country and really bring that experience back to benefit the local hospitals here in Atlanta. And so from that, I moved over to locums, and talking to those clinicians as well as other physicians that I've worked with over the years, really saw where there is a gap in that onboarding for locums. People assume, hey, they're a doctor, they're moving to a different clinic, they know exactly what to do. What kind of onboarding do they really need? And over the years, we've been enhancing our onboarding approach at locumtenens.com and sharing that with our clients to create a better experience overall, which has led to better patient encounters, more patients being seen, and longer retention with those locums.
Yeah, thank you for that. Tara, I want to, bring that same question to you from the permanent physician side, that onboarding experience. We're going to take a deeper dive, but just give us a little bit of an overview of what to expect there.
Sure. Well, as I shared earlier, my career in healthcare started as a physician liaison and then evolved to include strategic planning, business development, and physician recruitment directly for hospitals. So essentially, I was planning medical staff and service line growth and then recruiting the providers to bring those plans to life and then helping them to grow their practice. So when I found the world of permanent physician recruitment, it really felt like the closest way for me to continue utilizing those core skills and interests, but allowed me to really expand my reach and be able to impact healthcare organizations and communities across the entire country. When I worked as an internal recruiter, I really valued the long-term relationships I was able to build with the permanent providers I was recruiting and supporting. And I loved that I became a trusted professional advisor for them. So today, my role at JPS allows me to experience and deliver the same for both providers and clients. And I've had some of the same clients for the nearly 9 years that I've been with JPS. I feel like I'm an integral part of their team. And not just with recruitment, but onboarding and the long-term retention goals. So it's really rewarding for me to be now involved with sometimes even recruiting partners for positions that I helped to place in permanent positions several years back.
Yeah, I thank you. And I'm excited to get to talk to y'all ahead of this upcoming webinar. We're going to be talking about these particular topics. Probably a lot of our listeners now will be in attendance, so they'll be able to ask both of you questions at that time. But the webinar itself, it's really looking at onboarding through the lens of this recent research we were just talking about. Y'all collaborated with AAPPR. I want to get that right again. And I'm going to give a special shout out to them. I'll provide a link to their site in our episode show notes. Tara, I want to stay with you here. What was some of the interesting information, data points, anything else you want to share that came out of this research?
Yeah. So this research surveyed, I believe, 236 recruitment professionals and 1,550 physicians and clinicians to evaluate onboarding practices within their respective healthcare organizations and really capture those experiences of the providers, both qualitative and quantitative. A couple of key takeaways that I thought were of interest and worth noting, and we could take a deeper dive here, are that 94% of organizations do indicate that they require an orientation, and orientation and onboarding are not equal. Orientation is defined as a short-term new hire process. Generally, it's somewhere between a day and a week long, and it's really more focused on the HR and paperwork aspects of bringing a new provider in and getting them up and running within your organization. Whereas onboarding is more focused on relationship building and all the related activities that drive the goal of long-term relationships for all the parties involved. Typically, that would begin on the new hire's first day and extend 6 to 12 months is most typical, but a lot of times beyond. 89% of organizations reported an onboarding process, but only 72% of the recruitment professional respondents say that they have a formal one. So I think based on Jenny and my background of having been in the shoes of the individuals responsible for delivering this onboarding process, we've got our own opinions on how to create a robust onboarding program and how to seek, the proper feedback to continuously improve that experience with the goal of increasing job satisfaction for those newly hired providers and clinicians, and ultimately drive that long-term retention with your organization.
Yeah. Jenny, I want to bring that same question to you. What stood out to you when you looked at the research? Anything surprised you? Anything stood out to you from that?
Well, I've always known the importance of onboarding, but to see that 73% of the clinicians interviewed had higher work satisfaction based on having a good onboarding was kind of shocking. I mean, I knew that number was going to be significant, but that was a lot higher than I expected. They talked about, in most cases, less than 75% of the providers acknowledged having a mentor assigned, someone to talk to about policies, workflows, things like that are so vital when you're going from one practice to another that could be so different, even from location A to location B. And only 75% or less of them reported having that hands-on approach during their onboarding, which I thought was kind of concerning.
Yeah.
And definitely something that I think most people forget to add to a checklist. Like Tara mentioned, you get all those HR pieces, but it's the intangibles, that buddy or peer to talk to, that really can make a big difference. And I'd love to see more organizations incorporate that.
Yeah, it's really huge when you think about that. And I'm so glad that Tara made that delineation between orientation, which is, hey, you're a new hire and we're going to walk you around the building and you're going to shake a lot of hands. You're not going to remember any of the names or any of those people later. But this is orientation and here's all these benefits documents and all that to fill out. But then there's onboarding where you really do get that, maybe a peer, a buddy, whatever the terminology is used. And that person may not be and often isn't in your same department. So you really get an idea to see the organization from a different point of view. And maybe you go off site, you have a lunch, you have different things. And then you got, well, that's his, quote, a buddy. So I can go reach out to this person when I'm a little confused at some of the processes that are going on in this organization. So I wanted to follow up with you, Jenny, then, if you could share what this looks like from a locum tenens side. We get it. I've never been from that side. I'm in a temporary situation. I've been that long term. Hey, this is my forever job here. So, I'm hiring into this space. So this is different than I may be here for a set period of time. What is it from the locum tenens side? Help us understand that.
Yeah, so there's a couple different approaches there. Locums is definitely meant to bridge the gap as you search for your permanent providers. For some practices, that could be a couple weeks. For some, it could be multiple months, multiple years even in some cases. And so as you're approaching the onboarding, you really want to treat it similar to the way you would a permanent clinician coming on. And I think sometimes with the hustle and bustle, that kind of gets missed for locums specifically. Locums have expressed really wanting to talk to somebody before moving forward with an assignment who can provide that clinical perspective, let them know really what a day-to-day looks like in that facility, where their strengths and where are their opportunities for improvement when they're there, and be honest with them so they can have a good idea of what they're getting into as they're moving forward with their onboarding. They really want a clear understanding of what the onboarding process looks like, what's needed for privileging, what's needed for provider enrollment, what licensure is needed, just so they have an idea what time frame they're looking at. In some cases, they might be privileging for multiple different assignments at the same time and trying to figure out how that timing really plays out. And it makes a big difference in what their expectations are with next steps. Locums love having someone to speak to both on the clinical side and the administrative side. And because they do have so much experience in different settings, being able to share some feedback with this is working really well. We could improve some processes by doing XYZ and actually feeling heard and like they're part of the organization versus, someone who just showed up one day and is there to see patients. And then the other big piece is while they might have similar EHR training, making sure that they know your instance of the EHR, how to operate it, what to know about the workflows that are associated with it, because every instance is set up differently. And so the more they have that support and onboarding before they arrive on site, the better the whole experience will be.
Yeah. Tara, I saw you nodding numerous times at some of the things Jenny was saying. Is there anything you want to elaborate that, either from that permanent side of it, from the lens that JPS looks at it through, or even from the locums side of it?
There are a lot of parallels between locums and permanent providers. One data point that came from the survey results that surprised me was that permanent providers actually reported slightly lower satisfaction with onboarding, only 61% reporting excellent or very good onboarding experiences, and it was a little bit higher compared to their locums counterparts. For a permanent provider, I think the most critical elements, and this is feedback from the providers themselves, would include information on relocation and community details. Maybe, also a layer deeper when it comes to the networking and introductions and relationships. So I think when it's well executed, that should be introduced. Those elements should be introduced during the recruitment process and during the on-site interview visit, but should absolutely be reinforced after a provider signs the contract and then begins planning their relocation to the community. I think permanent providers also reported a higher level of interest in having comprehensive tours, understanding the organization's mission, vision, and values. They prioritize regular check-ins with supervisors. And as Jenny stated, really connecting in a peer-to-peer mentorship capacity to help them get acclimated into the organization and the community. And I think that can be great for many reasons, not only networking and helping to build referral streams, but also helping the family, if they're relocating with a family, get integrated into the community. I always think the quicker and deeper that you can help a provider lay their roots down, the more difficult it is for them to want to leave, later on down the road. But regardless, no matter if the provider is locums or permanent, both cohorts do very much value clear, frequent communication. I understand completely physicians are not unlike us, and that nobody likes guessing whether they're getting it right, especially in a new and unknown job and place. So frequent updates and feedback are really valuable for any new hire.
Yeah, Tara, you and I have talked multiple times, often from that recruitment side of it, and how vital it is to include that family. I mean, if the family members aren't happy and they're in the physician's ear, that's not going to go over well, because you want this to be a win-win. It's not a one-sided win. You want both the physician and family to be happy. You want the organization to be happy as well. We've talked about it from that recruitment side. But once you get to the onboarding side of it, what's the most important aspects of that to continue to nurture that relationship? Where do you fall with that?
So prior to, and I'll speak at this through the lens of a permanent provider and then let Jenny weigh in on the locum side, but prior to their first day, permanent providers typically do want to receive information about credentialing, where to report. This comes back to the orientation checklist a little bit, what to do on their first day, where to park. 85% of providers said that was really crucial to a smooth start on their first day and first week. Again, providers are telling us that they do want to receive comprehensive facility tours. And even if it happened during the interview process, they need it again during week one, including detailed introductions to the systems and technology. I think it's always prudent to review policies and protocols, and to provide an overview of the job and productivity expectations. They also said that introductions to team members and having a clear understanding of everyone's roles is really important. Like you said, the shaking of hands
Right.
and exchanging of business cards is great, but nobody likes the feeling of a test at the end of the first
Right.
week and then no follow-up support. And that's where also that peer-to-peer mentor can really come into play and being a huge asset to a new hire during those early weeks and months and even throughout the duration of their first year. Interestingly, both permanent and locums providers said that adapting to new systems and technology is the most challenging and probably overwhelming aspect of starting a new position. So I always recommend that no matter how tech savvy or confident a new hire might seem, really don't take any shortcuts in this arena. And, also don't underestimate the power of going to extra lengths to help network a new provider, building relationships with colleagues, integrating them into the team and the community. That really is the sticking power, for lack of a better way to say it, of a new hire. And although it does take time and extra, manpower to facilitate, I promise it will be time very well spent.
Yeah, thank you for sharing that. Jenny, I want to bring the same question to you. What are those locums physicians? What are they looking for in that onboarding process? What's the feedback that you got from the research, or maybe anecdotally from your own work and experiences?
Yeah, everything Tara said, there is a lot of overlap between locums expectations to make for a successful onboarding with what permanent providers are looking for as well. And so, efficient licensing, privileging, provider enrollment is key. Locums clinicians like to know who they should reach out to when they do have questions or specific workflows. Some day one things that are great is having their computer already set up, badge access already set up, any other details that could prevent them from seeing patients already being ready when they get there. Comprehensive and practical EMR training, IT training, so they know how to order their labs. They know, where the templates are so they can efficiently see their patients. For locums, it really does come down to the patient care. And that's the number one priority during their onboarding, is to make sure everything's ready so that they can see those patients who otherwise wouldn't see somebody. Interactive and supportive environment is always key, and then personalized attention and support. So very similar to what Tara mentioned, if they do all the EMR training, still checking back a couple of days later to see if additional questions have come up once they're actually able to put those workflows to use.
Do the locums physicians care about the parking space, like Tara said the permanent ones do, or are they
They
nonplussed
do.
about it?
No, it makes a big difference. And, sometimes where they park for that day one isn't where they're supposed to park
Right.
for the subsequent days. And knowing what to wear seems to be a big one that I hear from locums too. What do I wear to orientation? And what do other doctors wear in the clinic? So they don't stand out and they look like they're part of it.
Well, you made a great point, Jenny, that you just want things to work, because we've all started new jobs. It can be uncomfortable. And so you want all the other stuff to just work and be there for you. So then you can settle in and start doing your job, just like you were saying, just like getting to go ahead and see patients, whatever it might be, because why be worrying about, I can't get logged in, or why is it my badge won't let me into these different areas, those kind of things. You don't want that additional friction. You want that to be seamless and smooth so you can just go about seeing patients. That's really what it's about, right?
It's exactly what it's about, Daniel. I talk about it with my team all the time, understanding their operating reality.
Yeah.
Like, we've all started new jobs. We've all made that change personally. And to have somebody hold your hand throughout that onboarding process, send you a note, take you to lunch, something personal to make sure they're excited for you to be there. And then to continue that onward, once you do start, it makes such a big difference in everyone's satisfaction and just how they feel welcomed into the group.
Yeah. I mean, I don't know if it's a perfect correlation, but it's like a first date, and you don't want that to go terribly. And so if you start a new job, you want the new job to go well. You want to be accepted and go, I'm appreciated here. And this is a really good group and all the things. Wow, this is the kind of place. This is everything I thought it was in the interview process. And it is bearing fruit now that I've started the job. So let's talk about this. I know it makes perfect sense, but Jenny, I'll start with you here. Explain why this formal, because I think Tara alluded to a statistic, why a formal onboarding process is so crucial, not just, hey, we're winging it here. And so this is gonna work. But like we have a formal process. Here are the steps. So talk about that from that locums side of things.
Part of what we've used to enhance our locums onboarding has been from my previous experience. So when I worked at the hospital, I used to either do a video call, which back in that day was like unheard of, with the clinician or even the whole practice that was coming on, or I'd go on site and I'd walk them through, here's what you can expect for the next 3 months. 1 month before you come on, here's what you can expect, and kind of take them through that checklist. I would explain who's going to be reaching out, what their purpose is reaching out. And then internally, we set up processes where nobody reached out to them for documentation, for questions, until they checked with me first. And I'd say probably 90% of the time, I already had all of the documents that were needed. I had the answers to their questions because there were about 20 different departments involved, and a lot of the information they needed overlapped. So instead of bothering the clinicians over and over again with the same data points needed, they were able to go to one person and get that answer. So we've tried to incorporate that on the locum side and explain to them who's going to be reaching out to them for licensing, for CBO, for travel, all those different pieces. So they know who they are, what their purpose is. And we've tried to reduce any redundancies in the process to make for a smooth onboarding. And that's what you get when you have a formal process, is you know everything that needs to happen, and you can confidently walk them through what's going to take place, what they're going to need to do, what those timeframes look like. And overall, it creates such a better experience for that whole piece of it.
Yeah, I love that you brought in on the formal side of it. You have, whether it's an FAQ or you have, onboarded people before, so common questions. You can have those answered. You can have those ready where you go, I don't know, doctor, I will get back to you. And maybe by Friday, it's like, no, we've got this thing locked down. We have seen the questions that come in, so we can work with you. We can answer those questions and make your onboarding smooth. Tara, you brought up the percentages of those organizations that have a formal onboarding process. I wanted to follow up with you on that then and just see, how does that correlate to success? When you see that you have that formal process in place, that formal onboarding versus some of it's formal, some of it's we're going to work with you and we'll figure it out along the way. So do we have some data on that shows the success rate, or anything else you'd want to share with us about it?
We do. Here's what we learned from the survey. Of the providers who had a positive onboarding experience, 56% stated that they're highly satisfied in their job now. 35% stated that they're moderately satisfied. So that's an overwhelming 91% of providers that are satisfied.
Yeah.
Let me cut right to the chase. I think what it comes down to is that first impressions matter. The initial experiences that a new provider has as they walk in the door to your organization on day one absolutely do color their perception of your organization. So a well-structured onboarding process ensures that those first impressions are positive ones. And it does reinforce what you said earlier, Daniel, that they made a great decision by choosing your organization as a place to work is what it comes down to. We know for any of us, starting a new job is overwhelming. It can be sometimes nerve-wracking. And so, like Jenny, I always encourage to our permanent clients over communication on those first days and weeks to minimize the uncertainty for that new hire. Checklists and check-ins are really helpful, no matter if you're locums or perm, to ensure credentialing and everything that needs to be completed before day one is complete. That can occur as seamlessly as possible. And then to spend the next day or two conducting those tours, facilitating those meet and greets, and making sure those extra touches are in place. I like to make sure that we have business cards ordered, white coats, scrubs embroidered, and maybe even arrange for a coffee or breakfast with the CEO, CMO, or senior partners as part of the welcome experience on day one or week one. And then set a regular check-in cadence to discuss expectations, revisiting them often, and provide that feedback about how the new provider is doing and where they can or should improve, but making sure that you're making it constructive and supportive. I think by setting that tone early on, it really encourages transparent two-way communication, which in my opinion is really what sets the stage for short and long-term relationship building, which leads to additional mentoring opportunities. And, whether you're fostering the development of a specific skill or career coaching someone with leadership ambitions, it's all about integration and connection. And you can really set the temperature for that in those early days and weeks. So, by a well-executed onboarding process, I think that those providers are always more likely to feel engaged with their work and aligned with your mission, and overall more committed and a greater sense of belonging.
Yeah. Tara, we have been talking about all the ways to succeed, but what are potential challenges, just so our listeners right now can be prepared if there are challenges in onboarding programs, processes? What are those? How can you overcome them?
I think that primarily limited resources and bandwidth are the core of the problem with an effective implementation of a good onboarding program. According to the survey, 44% of the respondents were recruitment professionals who cited onboarding as one of their responsibilities, but not their primary focus. And I think part of that, as someone who was once a proud member of that cohort, I think part of that is due to a flawed philosophy of the C-suite, in that it's the most important priority to get a provider in the door. And I get that. So I encourage listeners to, do some self-reflection. And if you find yourself in a situation where you are faced with those limited resources and bandwidth, identify stakeholders who can help you prioritize and champion onboarding. There's a lot of aspects of onboarding that you can standardize and build out checklists or templates for. Many of those, again, are those orientation pieces of onboarding, but they can be built to scale. And then there are those other pieces that must be customized for different roles, different experience levels, to ensure that your new hires are receiving not only relevant information, but adequate training and ongoing support. But eventually, if you customize enough, you can start to piece those individual components together, kind of a la carte, in order to build, a customized onboarding program for all the different new hires, whether they're permanent or locums physicians or other clinicians. So you don't always have to reinvent the wheel for every single new hire.
Yeah, I love that you have that built out and explained in a way where we can, let's, build out this template, this checklist, this process here, and where we need to be, let's be flexible and we can customize some things. It reminded me when you talked about identifying stakeholders, that is so important because we've probably all been in a situation, either we're the new hire or we had been committed to, okay, at 2:00, I'm the one who goes and helps them do this next hour. And then things happen and then you're 15 minutes late, and that's not a good look. I mean, maybe you're the one, because I have been that person where I committed and then I'm going, oh my gosh, I am in the middle of this project or this meeting that I can't leave. And the new hire is somewhere sitting there just going,
Hopefully.
wow, oh boy, this is my first day and they've just forgotten about me. I'm in this room with no furniture. Well, there's probably a chair, but it seems like a police situation where you've just put them in this room. So, but thank you so much talking about stakeholders, because that really sets the tone with what we've got there. Jenny, I just wanted to give you an opportunity, whether it's in that stakeholder scenario or any other scenario where there could be challenges, because let's be honest, healthcare is not a sleepy sort of industry here. There's a lot going on. People are overwhelmed. People can be pulled into other situations. What are some best practices? Anything else you want to share about those challenges there?
Yeah, I mean, I definitely echo everything Tara said. Getting the stakeholders really involved is vital. I've had over the years situations where like entire division knew a clinician was starting Monday, and the person who was supposed to meet him had car trouble and wasn't able to be there. Nobody else in the practice knew he was coming and didn't know where to start, what to do, what his checklist was for the day. And nobody else had really been involved in that onboarding process. Everything else was centralized in the hospital. And so it made for a really bad first day.
Yeah.
So having redundancies put in place for scenarios like that always helps. So not one, but 2 points of contact with contact info. I've had the opposite, where the clinician had a flat tire or car trouble and wasn't able to get where they were going, or misread direction signs, things like that. So just making sure there's lots of open communication between the two, because that first day can really put a bad taste in their mouth, even though everything else about the organization is great and ready to go and you're ready for them. Making sure you have backups in place is key.
Yeah, I love that. Thank you for bringing that up as well. It goes back to, I think Tara had mentioned it earlier, about not feeling bad about over communicating, not just to the person who's being onboarded, but to the team, to make sure you have those redundancies, that you have a backup, to the backup. You're ready to roll because you're rolling out the red carpet for this person. You want them to love this place where they're, going to be either temporarily or permanently, whatever the scenario may be. For a final question, then I'll start with you, Jenny. I think you've hit on a lot of them, but have you held anything back? Is there any final advice you give to our listeners, these MGMA members, in helping them succeed, enhance those onboarding programs?
Yeah, I think we've talked about the importance of it a lot in this podcast, which has been great. I think understanding how to create the formal process can be a little bit more challenging. As we mentioned earlier, before the podcast started, MGMA has so many resources available between guides, checklists, other resources. Definitely lean into those. I've seen organizations use Excel spreadsheets, Google Sheets, Visio, Monday.com. There's so many tools out there to start building your program, and then taking time to pause and evaluate, do a postmortem. What went well? What didn't go well? Where's there opportunity for improvement? And get feedback from the people that you onboarded so they can tell you, this made perfect sense to me. This was confusing throughout. I felt like there could be more clarification here. I wish I had known is a big one that we always ask our doctors. So I definitely think there's always room for improving whatever process is there, but just starting to have a formal process will make a big difference.
Yeah, you make some great points there. Thank you so much, Tara. Last question for you as well. What final advice, final words would you want to share with our listeners to help them improve or enhance their onboarding programs?
I'd say if you're here listening to this podcast, you're You're in a great place to start, because no matter what your onboarding program looks like today, even if it's just more of an orientation, you are coming and listening and seeking out information to improve it, which makes you a very valuable part of the process for your organization. And I think figuring out your baseline is a really sound piece of advice if you are looking to move the needle. We were talking about limitations just a moment ago, and I think another big one is the ability to measure the effectiveness of your onboarding program. It makes it really difficult to identify areas for improvement without it, but planning and implementing KPIs will allow you to truly evaluate the success of your process. And, using surveys and feedback for new hires, as you were alluding to, Jenny, is really helpful to gather those insights and then make data-driven improvements. So from a permanent perspective, if your organization has never solicited that feedback before, I always suggest creating a benchmark by starting with providers who have joined your organization within the past 6 months, 1 year, and sometimes 2 or 3 years, whatever the benchmark is for a provider to stay after the initial contract term is up, and ask them what went well, what could have been better executed, what made the biggest positive impact at different time frames, and asking them if there's anything, you could go back and do over. What would that look like? And I, from a permanent perspective, always advise on asking those questions through both a personal and professional lens, both practice and community, work and family. And you've got to be receptive to constructive critique if you want to improve. But at the end of the day, onboarding is all about relationships. So keeping it relationship focused eventually will yield improvement and stack your odds for hopefully success when it comes to long-term retention of those hires.
Yeah. Tara, Jenny, thank you so much for joining me today on the MGMA Business Solutions podcast. Thank you all.
Thanks for having us.
Yeah, thank you so much.
Yeah, so everybody listening, this is going to do it for this episode of the Business Solutions podcast. But as we mentioned a couple of times during the show, there's an upcoming webinar where you'll be able to ask questions live. You'll be able to learn even more about what's going on the onboarding processes. You'll get to learn more about this research paper. And again, I'll reiterate it, you'll be able to ask questions. You may come there with a very specific question. You want that to be able to thread that needle of that particular challenge you may have in your own onboarding processes. So please be on the lookout for that, July 16th. You can go to mgma.com and get registered for that, or you can just look at the episode show notes. I'll have a direct link there in the show as well. Until then, thank you for being MGMA podcast listeners.